Hello math student, welcome back to the channel. The topic for today's video is learning the mnemonic for tumor suppressor gene TSGs and using them to solve clinical quiz questions. Okay, let's get started. Firstly, we'll discuss what are TSGs. As mentioned, TSG stand for tumor suppressor genes. These are the good genes. Their presence in the cell's DNA does not lead to the formation of any tumor, meaning these genes prevent tumor causing conditions. To make it simple, TSG act as a brake for the cell cycle, controlling the cell division. But if these genes are inactivated, mutated, or deleted, it lead to an uncontrolled cell cycle and which cause rapid proliferation of the cell, ultimately causing tumor conditions. And this process follows the two-hit hypothesis. Only when both copies of the genes are damaged, it will lead to tumor causing stages. Even if one copy of the gene is lost, mutated, or inactivated, the other gene, which is the good one, takes hold on the cell cycle and controls the cell cycle and prevent tumor causing conditions. Now that we have established the foundation, let's quickly review mnemonics and then dive into the clinical questions. Moving to the mnemonics part. So here I have a beautiful table which include all the genes, the chromosomal location and the associated tumor as well as the key mechanism. But for the video, our concern is first three columns as it will help you to solve all the question from pathology regarding TSG. So first gene is your P53. P53 gene is called as policeman of the cell cycle. So from policeman can be remembered easily. Policeman meeting policeman is just a dangerous situation. So remember, danger in Hindi is called as khatra, and the word opposite to khatra is your satra, that is number 17. So the chromosomal location will be 17p. Now how to remember the associated cancer is that whenever we are meeting police or we are in the situation of the police thing, then we usually don't want it, so we say for me nahi. So in layman term you can say for me nahi. So that will be your Lee for many syndrome. I hope P53 gene mnemonic is clear with you. So now moving to the next gene, that is the RB gene. The RB gene is called as the governor of the cell cycle. So to remember this gene, you should link it with the RBI bank, which is governing all the money in India. So here are two tricks to remember the location. First one is that the governor for money, those who sign on the currency bill, are 26. So you can divide it by 2 and the number comes out to be 13. So easily you can remember 13Q is the location, as P is for policeman, so Q is for RB. So 13Q is the chromosomal location. The second trick is that you can remember RBI बैंक किसको लोन देता है? तेरे को. Now Q देता है, so the Hindi Q stand for the letter Q, and the bank will just not give the loan to you, it will give to some other person also. So 13 plus 1 is 14. So 13Q14 can be easily remembered using this two thing. use anything which you want, but the 26 is the GK wala thing, so it's tough. And the RB gene, the associated disease is retinoblastoma, R retino, B blastoma. I hope RB is clear now. Okay, the next gene in the row is APC. We have to study the mnemonic regarding APC. So the trick here is that you have to go backward, like you have to start from CAP, meaning cap. You can remember cap or CPA, anything, but the cap is easy because cap fap is the rhyming. So from C later you can derive who control us, family controllers, so familial is the word. And from P we can derive polyposis, and for A you can remember adenomatosis. So here is the associated tumor: familial, adenomatosis, polyposis, FAP. Cap, FAP you can remember, that is also easy. Now for the chromosomal location, the letter F of the familial word, so F also stand for 5, so we get 5 from here. So P is beyond to the policeman, so Q is left, so Q arm. You can see it is written 21. So how that 21 come? If you count polyposis, adenomatosis later, then it will come around 20. Let's see. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19 and 20. So 20 here, and the familial word F stand for one letter. So 21. So this is the chromosomal position of APC. Now let's move on to the next gene, which is your P10 gene. So P10 is easy to remember. From 10, the chromosomal position is 10. And Q arm is there. So P is given to the policeman. So Q arm. 10 Den. So Cowden syndrome. Cowden syndrome is a significant part of your P10 hamartoma tumor syndrome. So this is all about your P10 gene and its tumor. Now moving to the next gene, that is NF1 gene. So N stand for neuro and F stand for fibromatosis. Type 1, 1 stand for type 1, but for neurofibromatosis type 1 will not every time say as type 1 type 1, we will just say as neurofibromatosis. Now to remember the location, count the number. So if you count the letters, it comes out to 17. And the Q arm, because P is for policeman, so Q. So 17Q is the chromosomal location. So this was for the NF1. Now moving to the NF2. NF2 is neurofibromatosis type 2. So if you count the letter of neurofibromatosis, that is 17, and for type 2 if you count the number of letters, these are 5. So 17 plus 5 comes out 22. So we got 22 number. Now P is given to policeman, so Q arm is given to NF2, rest are QQ, right? So the location is 22Q. Now moving to the next genes, that is BRCA1 called as BRCA1 and BRCA2 called as BRCA2. So you have to remember the mnemonic, that is ladies first. So obviously second will be gents, so gents are second. BRCA1 defect can cause breast cancer. So breast cancer is a danger condition for female. So again, danger 17, so meaning khatra 17 wala mnemonic. So you will get 17Q as the chromosomal position, and you remember it is breast cancer, and in female the specific cancer is ovarian cancer, which is the next association. Now moving on to the second, which is BRCA2. So BRCA2, it's given to the male. So male have prostate, so there will be prostate cancer, and also male will be suffering from breast cancer. So if male suffer from breast cancer, this is something unusual. So we will say तेरे को क्यों हुआ. So tera means 13, and Q will stand for Q letter. Hindi Q will stand for Q letter. So this was the mnemonic for BRCA2. Next on the list is the CDH1 gene, which is also called as E-cadherin gene. E-cadherin gene is the molecular glue of the cell, as it helps in cell to cell adhesion. If you modify C as G, then G stand for gastric and D stand for diffuse. And if you count the letter of diffuse gastric Ka, then it comes out to be 16. Let me explain you, like writing diffuse gastric cancer, we write it as diffuse gastric, and for cancer we use short form as CA. So if we'll count this, it comes out 16. So 16q is your chromosome number and the disease related to it. So the next gene is WT1 gene. WT1, W stand for Wilms, T stand for tumor. So Wilms tumor, pediatric age group tumor, so pedia. Now the mnemonic. If you write W, you are using two vertical lines like this. So two vertical lines indicate you the 11 number, and it is a pediatric age group tumor, so 11p is the chromosomal position. So the next is WT2 gene. The chromosome position is same, that is 11p. Remember two vertical lines of W, and standing for Wilms tumor as well as Beckwith syndrome, because it is 2, so it will have 2 associated disease. Next gene in the table is VHL gene. VHL gene has 3 letter V, H and L. So the chromosomal location is 3p, and it is von Hippel-Lindau syndrome is the tumor associated to VHL gene. Now remember, after WT we started using P as the arm position. Next is CDKN2A gene. So from here C is control, which is familial. For D you can remember melanoma, and for K, don't confuse it with kidney, but remember pancreatic kick, like K sound is there, so remember like that. And now you can count the letters of the gene. It comes out to be 6, like this comes out to be 6 letter. So if you do the mirror image of 6, it comes out to be 9. So you have the chromosomal location as 9p. The last gene in this table is STK11 gene. So it is the Peutz-Jeghers syndrome, PJS, 3 letters. This is also 3 letters. 3 plus 3, 6. Again, the mirror image is 9. And you can remember 11, take 1 from it. So it is 19p. It is better you mug it up that STK11 is the Peutz-Jeghers syndrome and 19p is the number. So this was all list. I hope you have learned the mnemonic. Now we can move to the clinical questions. So let's start with the first question. A patient is diagnosed with von Hippel-Lindau syndrome, which predisposes them to highly vascular tumor like renal cell carcinoma. And what they are asking us, what is the chromosome location associated with this gene? So VHL gene is associated, and we know that it is 3p. Okay, so directly the option is option A, and this is how you solve the question using the mnemonic. Moving on to the second question. So here they are asking about a 30-year-old patient which is diagnosed with Lee-Formani syndrome. The gene mutation is also given, the chromosomal location is also given, but they are asking about two-hit hypothesis. So according to this hypothesis, it is that 2 copies of the gene should get altered so that the cell cycle is affected, the cell division is uncontrolled. So for the option, you have to find the option regarding the mutation and the heterozygosity. So that is option D. So here is your answer. Here I'm just reading the stem of the question and I'm giving you the answer. So you will be able to solve most of the question regarding this while using this mnemonic. Moving on to the next question. So a 6-year-old patient with Wilms tumor but VT1 or VT2. So it is given that it is VT1 in the next sentence. So what they are asking us, which is the gene associated with the chromosomal arm. So I said W should be written with two vertical lines. So two vertical line means 11, and this is in pediatric age group tumor. So it is 11P is the answer, which is option number B. Now the last question, it is about retinoblastoma, that is RB1 gene, and they are asking where is the RB1 gene located according to your mnemonics. So your mnemonics will not come, so cancel it. Okay, so it is asking you RB1 gene location. Have to quickly recall the RBI mnemonic for the RB gene, which I said you two mnemonics. I said one was about the 26 governor, so 26 divided by 2, that is 13, so 13Q, and the next was Tirco Q loan, like 13Q14. Okay, so these were the two mnemonics, and you will get easily the answer is option number A. So this was all about my video. I hope you like this tricks and mnemonics. Hit the like button if you like the video, and do subscribe to my channel. Thank you for watching.